we are learning that how to make a DNA fragmentation analysis slide, let's also understand why it is important. So while embryo formation, if the sperm DNA has nicks and breakages, it will hamper the formation of transcription and the replication of DNA for the progeny. So we will get repetitive pregnancy loss or either implantation failures or incomplete missed abortions. To analyze whether this is because of DNA fragmentation in the sperms, we are preparing the slides. So the first step for a DFI preparations is that we have to analyze the count of our sample. So first of all, we have to look whether our sample is liquefied or not. As you can observe that this is the entire liquefied sample. See how beautifully it is coming drop by drop. So once we have ascertained that it is fully liquefied, we put a drop on a slide and cover it with our cover slip. Take it to the microscope. As we can see that the count is 80 to 90 million with a 55% of motility. Welcome friends to another training session for DFI sample preparation. So when we have to analyze the DNA fragmentation index, so how we are preparing the slides, this will be showing in this process. So let's look into the things that are required. So there is a DFI kit. What the kit contains is coated slides, then very important agarose gel vial, cover slips, and there is a diluent solution which is given. Now why it is important, we will see in a subsequent when we will be showing you the slide preparation. This is the diluent solution. Then lysing solution, which is known as Lys A. Another lysing solution, Lys B. Fixative, and there are two stains, Gimsa A and Gimsa B. We have been provided with a low melting agarose. We will be putting this in our already started 80° of temperature. This agarose, which is solid on your room temperature, will liquefy, and we have to add our diluted sample to it. So as we have identified, this is a totally liquefied sample and we'll use 1:8 dilution. So we'll take 0.1 of our sample in a tube and 0.8 from our diluent solution. So we have put our agarose after 5 minutes. As you can see, this is totally liquid. We will be putting our diluted sample, 40 microns, which is 4 times Cetica, and mixing. As you can see, so we will be mixing our sample with our agarose and then we will be setting our to 20, 2 drops Very carefully keep the cover slip and with very light hands, otherwise it will stick to your egg rows and later on create a problem. Now write the name of the patient and name it. Cover slip we have put. Now we have to let the agarose gel set. For setting of the agarose gel, we have to keep it in refrigerator from 5 to 8 minutes. We'll delicately with our gentle sliding movement of the hand, we'll remove the cover slip. Now you can see my egg rows with embedded sperms is still on the slide. You can see clear demarcations there. So we're not using any solution which is pre-prepared. We'll be preparing it freshly. Mixing 1 ml of your the powder lyse A. We are adding lyse A solution and we'll mix it properly. No, just vortex it. No. We have to mix this properly and ensure that the mixing is proper. Cover the entire slide with this solution and keep it for 5 minutes. After 5 minutes of lyse A solution, keeping the slide for the lyse A solution, we'll drain the solution. Then add lyse B. Lyse B will be from around 40 seconds to 1 minute. We'll drain that. Then we'll add fixative for 2 minutes. We'll keep the fixative for dehydration of a sample for 2 minutes. Then again we'll drain that and add Giemsa A and Giemsa B to my slide. The staining will be kept for 5 to 8 minutes. We'll drain off the lyse A solution and pour lyse B. Again with the entirety of my slide. After 1 minute, we'll drain. So this is important. We have to drain it properly. Then we have to again add fixative and allow it to dehydrate. So we'll add Giemsa A and Giemsa B. So Giemsa is a blue stain, Giemsa B will make it equal drops. Mix it properly. Again entire cutting of the slit. We'll be keeping this for 5 to 10 minutes. Very important point is you have to make sure that the surface is even so that it is evenly distributed on your slide. After 10 minutes of staining, we'll again drain the extra stain and keep it for drying. So the question is now how to judge what is the limit for DNA fragmentation. So if my DNA fragmentation index is from 0 to 30, my DNA fragmentation index is within normal limit. If it exceeds 30, so anything which is beyond 30, say be it 33, be it 40, be it 45, it will have some impact on the formation of the embryos.